Hey guys, Rachel Schumate here with Cornerstone Physical Therapy. I want to talk to you today about one of the core muscles, and I'm not talking about the glory muscle, the six-pack that everybody thinks is the core muscle. It's really only like the front part of the core. I want to talk to you about transverse abdominis. So that one actually is this huge muscle that goes all the way around the front and the back. So it wraps around here too. It basically transverses the abdomen, as it's named, and when it functions well, it actually works kind of like a back brace for the lower back. So the problem a lot of my patients have that have low back pain when they're doing things like lifting or squatting or more dynamic activities or stuff around the house, they have issues with the low back because they're bracing with rectus, like the upper abdomen, and that is not going to help brace the low back. So if you can activate transverse abdominis, then that will help kind of guard that area. So let me show you how I teach my patients to work on that. Set this down. So usually I have everybody lie on their back with their knees up. I say find your hip bones. So you got your hip bones, and then you're going to walk in a couple inches and then try to put some pressure in through the lower abdomen, okay? So I want you to put pressure here and then kind of draw in the lower abdomen. So I'm drawing in down here. I'm not using my legs. I'm not tucking my butt. I'm not lifting. I'm not doing any of those things. I'm not arching. I'm drawing in down here so it feels like there's a belt tightening. Okay? So you should be able to do this. Draw in and hold it while you breathe, while you talk, while you move your legs, while you do other things, because it needs to be operating in the background. Okay? So with ladies, with women, I usually say try to think of doing like a Kegel exercise, or how you feel when you're doing like a leg lift. It's that lower abdomen. With guys, we have a saying, but we're probably not going to use it for Facebook. It's not exactly appropriate, but it works great. So I'm going to say draw your male parts up, and that tends to work pretty well for the lower abdomen. It's not a full-on contraction, so it's not like tuck and hold as much as you can, because that's just not realistic to maintain when you're doing things throughout the day. I would say once you can figure out how to get it with lying down, then try to practice in sitting. See if you can find it in sitting, and then try to practice in standing. But when you're standing, make sure you're not locked out, because you don't have control over your pelvis when you do that, okay? So if you're standing, your legs are loose, try to kind of use that same cue. See if you can draw in, and it's going to cause you to tuck your butt just a little bit, okay? I'm not tucked all the way. I'm not walking around like this, and I'm not poking out. I'm in between with like a neutral, all right? So find it in different positions. When you go to lift, when you go to clean, try to engage that muscle first, just in the background, like a 0 to 25% contraction, not 0 to 100, because then you can't breathe. But this muscle is beneficial for digestion, for pushing babies out, for protecting the back. It's a super important muscle, and most people don't know how to use it. So if you have questions beyond what we've talked about, feel free to email us. You can call us. Most of us have our email at simple name at cornerstoneptnc.com. So my email is rachel@cornerstoneptnc.com. You're welcome to email me. I know everybody's kind of at home right now, so just take care of yourself. We're trying to post as much as we can on social media and try to help you guys out from afar if at all possible. Keep your hands clean. You take care. We'll see you soon.